Hello everybody, Nurse Scott here, how are you? If this is the first thing you've ever clicked on my channel, let me introduce myself. My name is Scott, I'm a registered nurse, worked in the ER for many years. For the last several years I've been sidelined with a bad back. I'm back in grad school to earn a master's degree and become a family nurse practitioner. Now that we've got that aside, let's talk about today's video. The second most popular video on my channel was how to give yourself a painless self-injection. The number one most popular was when I went to the ER when I couldn't breathe. So you guys like to watch me suffer, I guess. I don't know. But anyway, I've gotten such a huge reaction to the self-injection video. Some of you have told me that it's even changed your lives because you're no longer dependent on your doctor or your girlfriend or someone else to give you the injection, or just because it's relieved the anxiety about giving yourself a shot. And so that's very rewarding. I mean, for me, that I just am tickled every time I see a new comment. And there have been tons of comments and tons of questions. And that's why we're here today, is to answer some of those, like the top 5 questions that I've gotten on that video. Before I start, I have to emphasize that I'm not giving medical advice, okay? I'm sharing information that you might find useful. It's important to always check with your provider to make sure that what you're doing is right for you. And I'm not going to preach, but I do want to say that this is intended for people that are injecting legal, prescribed drugs, like fertility drugs and vitamin B12 shots, hormone replacement therapy, osteoporosis drugs, gender-affirming therapy, that sort of thing. Please, if you need to, educate yourself from reliable sources about anabolic steroids, okay? You may be seeing gains at the gym, but there are some side effects that you can have, and not the least of which are shrunken testicles and female breasts, okay? So that out of the way, here are the questions. Question number 1. After I pulled the needle out, I saw some blood come out. Is that normal? Did I lose the medication? And the answer is a little drop or a trickle of blood is normal, and just put some pressure on that. It should stop in a couple of minutes. You probably didn't lose enough medication to worry about. To avoid this, you may want to use the Z-track method, which I'm showing here, where you pull the skin to the side and inject the medication, and then the track that the medication went in through is disrupted when you're done, and it can't get back out that same way. So try that. It is part of the technique that I show, and it may help with that. If you bleed a lot, talk to your doctor, and I'll show you. Let me just show you right now. I have a video that I made. I was like, I'm going to do a new injection video for this question and answer video. And when I did it, I bled like a stuck pig. And it looks like a lot, but again, and that's actually not normal. That's a little bit abnormal. I checked, I was not in a vein or an artery, so it just happens. You put pressure on it and it stops, okay? That's okay. Now today I had to do another injection. I recorded it. Take a look. Not a drop of blood. You cannot even tell that I did an injection at all, okay? So sometimes it just depends on how many capillaries are kind of in the area that you inject, whether you've pulled the skin aside or stretched the skin or flexed the muscle. And again, it's nothing to worry about. You put some pressure on it, it goes away. That really is, it's a number 5 question, but it really was asked so very often, and I had to tell people it's nothing to worry about. Don't freak out. No, I didn't screw up. That's just what happens sometimes. Question number 4. Isn't it dangerous to have air in the syringe? That is actually an old myth, an urban legend, if you will, that injecting air into the body will cause harm. Well, most of it is. If you inject into a vein, it may potentially cause problems. And if you inject even just a small amount, 1 or 2 milliliters of air directly into the arteries of the brain, that can cause a stroke. But we're nowhere near the brain. We're not even in a vein. In fact, the research has showed it takes anywhere from 20 to 200 mils of air injected into a vein to cause a problem. That's almost a cup of air. That's this much air being injected and into a vein. So a tiny bit of air injected into a muscle is not a problem. In fact, it's called the airlock technique. The idea is that when the medicine goes in, the air floats to the top and keeps the medicine from coming back out. Of course, we've also used the Z-track technique I just talked about. So you might want to use the Z-track technique. And if you don't feel comfortable with the airlock, then don't use it. Don't put any air in the syringe. That's just fine. Question number 3. What do I do if I get blood back into the syringe when I pull back on the plunger? This is where you have to stop. Take the needle out and start all over again. Prepare a new syringe. You don't want to inject medicine that's intended for a muscle into a vein. That's all there is to it. If you get blood back, stop, start over. Question number 2, what size needle should I use? In general, you want to use the smallest needle that you can get away with. I use a 22, 23, and that's okay for what I'm injecting. With testosterone, it's an oil-based medication, and so it's very thick. So to draw it up from the vial, I use an 18 gauge, something that's larger. Remember, the smaller the number, the larger the needle, okay? It's a little backwards. Some people might think it would go the other way, but that's the way it is. And they're all color-coded, in case you didn't know. Any needle you find in a hospital, whether it's an IV needle or an injection needle, they're color-coded, so you know right away what size it is. So use a larger needle to draw it up because it's thick. A 22, I wouldn't go any smaller really than that because then it just takes a lot of pressure to push that plunger and get that medication, that thick medication, through a small opening. But if you use a water-based medication, you can use a smaller needle. And how long should it be was another kind of part of that question, and it should be long enough to get down to the muscle. If you have a very thin fat layer on top of the muscle, your needle doesn't have to be that long. If you have more fat on top of the muscle, you're going to need more needle to get down there. It also is important how far you put the needle into the skin. You have to get down to the muscle because you don't want the medication that's intended for the muscle getting into the fat tissue. And the number one questions that I get after I inject, I'm sore. Is that normal? What can I do about it? And the answer is yes, you're going to be a little bit sore when you poke yourself with a sharp object and you squeeze a foreign substance into it. A little bit of soreness makes sense. It might be a little bit pink, it might be a little bit tender, but you should be able to rub over it and get the soreness out of it. If it's more red, especially on the next day or the next couple of days, if it's very tender to the slightest touch, if it's warm, that may be an infection. You need to go see a medical provider right away for that. A little bit of soreness should go away with some rubbing. If not, you can put a cold pack on it for a little while. You can take Tylenol or ibuprofen, over-the-counter medications. Just follow the directions on the bottle, or just go about your day and try to get it out of your mind. It's just one of those things when you have to inject medication, you expect there's a little bit of soreness. It's something you just kind of put in the back of your mind and go about the rest of your day. I hope this information about intramuscular injections helps you. And just so you know that the technique here is for intramuscular injections into the muscle. Some of the techniques might be transferable into a subcutaneous injection or an injection into the fat underneath the skin, but not all of them. So just so you know, it's similar, but not quite the same. It's been great knowing that this information has empowered so many of you to do your own injections. If you have any questions, please type them in the comments below. Take a look around the other videos on my channel and be sure to like this one and consider subscribing to the channel and click the little bell so you'll be notified when new videos are available. Thanks for joining me, and I'll see you next time.